The convening of this event cannot be more timely. Healthcare systems are experiencing extreme pressures due to the coronavirus pandemic. Medical resources and staff being diverted to respond to the crisis. Lockdowns and quarantine are restricting access to cancer care. Treatments delayed and cancer screening services cancelled, and reports are also emerging of disruptions to drug and equipment supply chains. Clinical trials and research projects are on hold. Conferences are being postponed, and many cancer organizations are facing an as yet unknown financial impact of the crisis. Incredulously, we have seen that even the most advanced, supposedly solid health systems buckle under the strains of the double burden of having to deal with corona and cancer. Tragically, the reduction and delay in cancer care is expected to result in a rise in cancer incidence and mortality in the near future. Having said that, it has been extremely heartening to learn about how our cancer community has innovated and adapted to address the real challenges people face on the ground, day in, day out. The stories that have been shared are nothing short of heroic, with both personal and collective Herculean endeavors being made to ensure that cancer diagnosis and treatment are not run over by the COVID-19 destructive machine. COVID-19 has been the ultimate revealer of what we, as a global health community, have been saying and calling for far too long: end the divisiveness between diseases. Furthermore, we have also spoken about the need to move towards universal healthcare coverage, UHC, a vehicle founded on equity, on not leaving anyone behind, on a patient-centered approach, and on the strengthening of primary care. The European Cancer Organization, with its federation of 31 medical societies and 20 patient advocacy groups across Europe, put cancer patients at the center of their concerns by involving them in their policy-making and activities. ECO walks the talk. At this year's summit, European Cancer Organization brings together leading oncology specialists, patient advocates, politicians, and policymakers to discuss the main issues impacting cancer policy across Europe. Special focus will be on the inequity of cancer care in Europe between countries, within countries, between regions, and between social groups. We, as UICC, are very proud of our partnership with ECO. As member organizations, collaboration is in our DNA. ECO actively engages with UICC's global advocacy activity, including participating in the UICC Global Advisory Consultation Group. We also applaud ECO's HPV Action Network for showing leadership to the world by embracing the elimination of cervical cancer global goal and making HPV cancer elimination a formal European shared goal. I invite you all to join me online at the European Cancer Summit on November 19, 2020, where I will be joining Dr. Matti Apro, President of ECO, as well as past President of UICC, Professor Franco Cavalli, and other distinguished panelists to talk about the pressing cancer issues that we are facing. While social distancing worked for corona, social cohesion is exactly what we need now more than ever. We do need all hands on deck. If there's one lasting thing that COVID-19 taught us, as aptly put by Martin Luther King, we may all come on different ships, but we are all on the same boat now. Thank you.